Good morning, everyone. We're going to give folks just a couple more minutes to log on, and then we'll get started.
Why don't we go ahead and get started? Good morning, everybody. My name is Alina Vasquez, and I am with Human Services Research Institute. I will be the person giving you the presentation today called The New Budget Model and You. The presentation today is specifically for individuals who use supported living services within the traditional model from the Adult DD program. Is there anything you want to add, Livia, before we get started?
Yes. Thank you, everyone, for attending the training today. We want to take this opportunity to remind all attendees that the purpose of today's training is to convey important information about the implementation of the new budget model. We welcome questions during the training, but we have a great deal of material to cover, so we ask that these questions be concise, respectful, and stay focused on the topic we're discussing. If issues or questions are raised that are outside of the focus of this meeting, those will be held and addressed at a later time. If any attendees become disruptive and impede the learning opportunity for others, we reserve the right to mute or remove them from the meeting. These trainings are recorded, and you will be able to review the materials once posted on the My Choice Matters website.
Thanks, Livia. So as Livia mentioned, we encourage and welcome folks to ask questions during the training today. We will be pausing throughout the training to address questions, and people will be welcome to raise their hand and ask those questions verbally. You also can type any questions you have into the chat box. Be sure that you direct those questions to either all panelists or everyone to be sure that any questions that are typed in the chat box are recorded. Also, as Livia mentioned, a copy of this training, as well as a recording of this presentation, will be posted on the My Choice Matters website for you to review at a later time. And there are many additional ways that you can get information on the new budget model. One great way is by going to My Choice Matters. That website has updates regularly about the new model and about implementation. I'll also note that there will be a survey at the end of this training where we will ask you to please respond and give us a little information about your thoughts on this training and what other kinds of information you might need about the new model. We really want to make sure that everyone has all of the information they need as we roll into the new systems changes, and we will be sure to offer additional trainings and additional materials if requested from individuals on specific topics. The new budget model will start as early as June 2022. As I'm sure folks are all too well aware, June 2022 is just around the corner, in the middle of next week. The department is still awaiting approval from CMS for the new budget model. CMS is the Centers for Medicare and Medicaid Services, and they are the federal agency who has to approve any changes that the department wants to make to the services they offer that are on the DD waiver or on the 1915I state plan. That approval has to happen before we can move into the new model. And so, while we don't know the exact date of the implementation, it is still the department's intention to get things started just as soon as possible. So when they have more information and know exactly when we can expect that approval from CMS, they will let everyone know via news blast, and we'll get that posted on the My Choice Matters website. So, with the implementation of the new budget model anticipated as being just around the corner, we wanted to give you a training today that explains a few key elements. This includes the new assessment tools that will be used, the new way we will be setting annual budgets, and the new services that you can choose from within your annual service plan. We're going to review all of those topics in our short 2 hours today. So let's go ahead and get started. As I'm sure a lot of folks are aware, there is a group known as Community Now. Community Now was formed because of a requirement under the KWV Armstrong lawsuit for additional stakeholder input. When Community Now was initially formed, there was a series of meetings that were held in close succession, so really close to one another, over about a 6-month period. At the end of those 6 months of meetings, Community Now issued a set of recommendations and gave those to the department. These were a set of recommendations about ways to improve the adult DD system to make things better for participants. Community Now made a lot of recommendations, some of which included adding a more flexible services model to support adults with IDD to meet their needs and explore their interests in the community. They also included suggesting that more pre-vocational, career planning, and individual support and employment services be added to the services that the department offers. The service changes that are coming as a part of the new budget model are directly the result of the recommendations from Community Now. Just so you know, Community Now has not ended. Those meetings continue going, and the group continues to work on helping to see the recommendations they put forward get implemented over time at the department. There are a few main changes to services that are happening, partially and mostly in response to Community Now. The first are big changes to supported living. For one, high and intense are going away. Instead, individuals who currently receive high or intense will be able to use supported living as well as getting other services such as adult day health, developmental therapy, and one of the new services, community habilitation, in addition to the supported living services they receive. If you would like to keep getting 24 hours of support from your supported living provider, you can do so. And we'll talk about exactly how that's possible under the new model in a little bit. We also will be adding 3 new services: pre-vocational services, career planning, and community habilitation. The sublimits that exist for a lot of services are going away. So right now, the rules in Idaho say that you can only get 30 hours per week of a combination of services like developmental therapy and adult day health, but that rule will be going away. And instead, participants can build a plan that makes the most sense for them and is available within their budget. One additional change is the department is working to increase access to non-medical transportation. This is the kind of transportation you can get to community activities or to go between the different services you receive. Just a note that the transportation you would get to go to the doctor or to go to developmental therapy comes from a different source. That is called non-emergency medical transportation. What we're talking about is transportation support that comes directly from the adult DD program. The change to that service is that it used to be on the adult DD waiver. The department will be moving that service to the HCBS state plan. This will make the service available to more individuals because there are some people who get adult DD services only through the state plan and aren't able to use waiver services. This means that more people will have access to non-medical transportation to get to do the things that are important to them in their community. To organize our presentation today, we want to walk you through all of the key steps that exist in receiving adult DD services every year. For most participants, the first step each year is to get your assessment. Right now, that assessment is the CIBR. Once the assessment is complete, you will then get a notice that includes your budget. You'll be able to use that budget with your plan developer and person-centered planning team to develop a plan for the service and supports you would like to get for the year to come. That plan then gets submitted to the department, and a care manager will review and approve that plan. Once a plan gets approved, you then are able to get the services that are in your plan. For lots of participants, they will just get those services all year until it's time to get their next assessment. However, some individuals may need to make changes during the year. This could be needing to change what services you're going to get, or could be changing what provider you're going to use. If that's something that you need to do, there's a step available for that as well to make sure that the services and supports you get are best able to meet your needs. There's one additional step for individuals who are first applying for the program. That is the application itself. There has been a slight change to the application as we move into the new model. So that's where we're going to start. As you can see on this slide, here's an excerpt of the Adult DD application. The application includes your name, your address, where you live, whether or not you're enrolled in Medicaid, your birthday, and then asks a question around what services you are seeking. This is the part of the application that has changed as we get ready for the new model. The new question will read, what services are you seeking? And there are three different options. You can say DD Waiver Services Traditional, DD Waiver Self-Directed Community Supports, or State Plan HCBS Services. This line will now include a list of the services that are available from the DD program from the state plan. This includes service coordination, community habilitation, developmental therapy, and non-medical transportation. The application is a very important part of the process because the application is what tells the independent assessment contractor, or Liberty is who the current IAC is, what kind of services you are hoping to get. It's important that you understand that which box is checked on this application will then determine what kind of eligibility notice you get. Liberty will only tell you whether or not you're eligible for those services you have requested. So, if somebody only applied for state plan services, then they can only get those state plan services, even if they meet the criteria to get DD waiver services. Now, it's still possible to change that selection in the future, but it is a little bit harder and takes a little more time. So it's important that when someone completes the application, they know exactly what box they are checking and what that means. Just because the application is changing does not mean that you will need to submit a new application if you're already an enrolled participant. If you're already in the program, no need to worry about this step. This is really focused for people who are asking for services from the program for the first time. Now let's talk a little bit about why someone would get HCBS state plan only versus DD waiver services. Individuals will get state plan HCBS only services generally for one of three reasons. The first is that someone does not meet the requirements to receive DD waiver services. The second is that someone did not apply to receive DD waiver services, like in the example I just talked about. The third is someone is choosing to receive services through another waiver. For example, the Idaho Aged and Disabled waiver. CMS, so again, the Centers for Medicare and Medicaid Services, say that you can only get services through one waiver at a time. So if someone is elected to get services through the Aged and Disabled waiver, they can't also get DD waiver services. However, if they meet the program eligibility requirements for the adult DD program, they can still get those HCBS state plan only services. Individuals who qualify for the DD waiver can get those services because they meet something known as ICF ID level of care. What that means is that someone needs the kinds of support that would be provided in an intermediate care facility for individuals with intellectual disabilities. You have to meet ICF ID level of care and then say that you don't want services in an ICF ID in order to get waiver services. What you are waiving or saying no thank you to are those services in an ICF ID. Individuals who meet ICF ID level of care can also receive all of those services that are available on the HCBS state plan. So if you are eligible for the waiver, you can get both waiver services and state plan services. It's only individuals who are eligible for the DD waiver who get to choose whether they would like to go traditional or to self-direct their services. Someone who selects traditional gets to pick eligible providers who then will provide their services. Someone who chooses to self-direct will independently hire the community support workers or CSWs they want to provide the services in their home and in their community. If you hire your own CSWs and decide to go self-direction, there is more flexibility and choice, both in the services and the supports that you receive. However, there are also additional responsibilities because on self-direction, you are the employer and are responsible for the community support workers who you have hired. Now let's talk a little bit more about the first step that most of you engage in every year, the assessment itself. As we already mentioned, the SIBR is going away. Instead, it will be replaced by two new tools. The first tool is the Vineland 3. The Vineland 3 is the tool that will help identify if you are eligible for any adult DD services, which means you are program eligible, and whether you can receive DD waiver services, meaning that you meet ICF ID level of care. The second tool, the Supports Intensity Scale Adult, or SIS-A, is used to help determine the annual budget using the new model. So as we roll in to the new model, we're going to have to revise the assessment schedule for just a little while. Usually, each participant only needs to get a full assessment every 3 years. However, during the next year or during the implementation year, all participants are going to need to get a full SIS-A and a full Vineland 3 in order to roll into the new system. Getting a full assessment takes a lot longer and is a lot more work than just doing a focused review, which is what happens in the 2 years you don't get a full assessment. A focused review means we just review the responses to your assessment the year before and make sure there haven't been any major changes that would make that assessment no longer accurate about your support needs. Because it takes so much longer to do a full assessment, the schedule normally is that only 1/3 of participants get a full assessment every year. But during implementation, all participants are going to need to get a full assessment. So as a result, participants will then be subdivided into 3 groups to help decide when they will get their next full assessment after we get done with the initial implementation. As you can see on this chart, individuals will be divided into 3 groups: Group A, Group B, and Group C. Everybody has to get a full assessment this year. Then, individuals in Group A will be getting another full assessment next year. A full assessment, again, is a SIS-A and a Vineland 3. Those individuals will then get 2 years of focused reviews before getting their next full assessment. Individuals who are assigned to Group B will also get their full assessment during implementation year. Will then get 1 year of a focused review, but then will need to get another full assessment in the following year. After that next full assessment, they'll get 2 focused reviews before having to get their third full assessment. Individuals who are assigned to Group C will also have to get that full assessment during implementation and will then get 2 years of focused review, just like on the normal schedule, before getting their next full assessment. Individuals will be assigned to these 3 groups at random for the most part. The one exception is that if you or respondents on your behalf participated in a practice SIS-A in the last few months to help assessors finish their training to provide the SIS-A, you will be automatically placed into Group C. This is as a thank you from the department because we know that you just did a SIS-A to help with the training and will have to do another full SIS-A here pretty shortly as a part of moving into the new model. Everyone will be informed of which group they are assigned to around the time of their first SIS-A and Vineland 3. Individuals who have a change in condition, meaning that they have a major change in their support needs at any time during the roll-in schedule, will go ahead and get a full assessment as soon as it is needed, and it won't matter which group they were assigned to originally. Any new participants who enter the program will receive a full assessment on a regular 3-year cycle based on when they come into the program. Folks will know when they should expect to get their first full SIS-A in Vineland 3 based on when they typically get their assessments. So if you just had an assessment in April, then it likely won't be until next April that you'll get the SIS-A and the Vineland 3. If you normally get your assessments in December, then it will likely be in December of this year that you will get your SIS-A and your Vineland 3 to move into the new model. So as I mentioned, there are 2 new assessments. The SIS-A asks questions about what kinds of support you need for day-to-day things in your home, in your community, around lifelong learning, employment, health and safety, social activities, and medical and behavioral needs. Some of the answers to the questions in the SIS-A will be used to determine your support level, 1, 2, 3, M, or B. Your support level, along with something else known as your service mix, is what determines your budget. And we'll spend a lot more of the presentation talking about that in more detail. The Vineland 3 is the tool that is replacing the SIBR for purposes of determining eligibility. The questions in that tool ask about your skill and your needs in areas like communication, daily living skills, socialization, motor skills, and maladaptive behaviors. Your scores from the Vineland 3 will determine your eligibility for state plan only, for DD waiver, or for both. Assessors use the scores that you have on questions in the Vineland to see that you have substantial areas of need in at least 3 of 7 areas, including self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency, as we're going to talk about on the next slide. So everyone who is eligible for the DD program is eligible to receive state plan HCBS services. There are 3 criteria that you must meet in order to be eligible for the DD program. The first is you must be an adult, meaning you must be 18 years or older. The second is you must have a qualifying diagnosis that was made before the age of 22, and you need to submit documentation about that diagnosis with your application. Diagnoses that are included are things like intellectual disability, autism, cerebral palsy, epilepsy, or other closely related conditions. The part of eligibility that's assessed with the help of the Vineland 3 is whether or not you have those substantial limitations in at least 3 major life activities. In order to be eligible for the program, you have to have a substantial limitation in at least 3 of these 7 areas. Information from the Vineland 3 is what will tell the department what areas you have a substantial limitation in and whether or not you've met the requirement of having a substantial limitation in 3 areas. In order to be eligible for the DD waiver, you have to meet ICF-ID level of care. In order to do that, you first need to meet all of the general program requirements that we just talked about on the last slide. You then need to also require something known as an active treatment. That is assessed by Liberty assessors during the interview and by reviewing your documents. The third piece of criteria is that you need to either meet the functional, behavioral, or combined functional and behavioral criteria for care in an intermediate care facility for people with intellectual disabilities, This is the piece that's measured using the Vineland 3. So long as you meet all of the DD program requirements, require active treatment, and meet either the functional, behavioral, combined functional behavioral, or medical criteria. For an ICFID, you would be eligible to receive waiver services and can then choose whether or not you would like to self-direct or use traditional. The next assessment is the CIS-A. Again, the CIS-A is used to get you to your support level. There are specific portions of the CIS-A that are used to assign participants to levels 1, 2, and 3. Levels 1, 2, and 3 are specifically around grouping people who have similar general support needs. Those areas are Section 2A, Home Living, Section 2B, Community Living, and Section 2E, Health and Safety Activities. Section 1 of the CIS-A and the supplemental questions are asked to get information about someone's extraordinary medical and behavioral support needs. This information is helpful in identifying people who may meet the criteria for levels M and B. Those are special levels for individuals who have extraordinary medical or extraordinary behavioral support needs. One question we hear a lot is, why do individuals need to complete the entire assessment if the department is only using parts of it to determine their budget? The reason we ask that you do the entire assessment is that it will help you and your person-centered planning team get a better understanding of all of your support needs and develop a service plan that's going to best meet your needs and enhance your quality of life. The other reason is that while we are initially implementing, we are also evaluating every part of the new budget model. It could be in the future that we want to add additional sections of the CIS-A to what we consider when getting somebody into their support level. If that's the case, we need to have information or data about all of the responses to the CIS-A in order to see if there are additional areas where we would also want to assess people and use for getting into levels in the future. I'm going to do one more slide and then pause for questions. This is a slide that shows you a little bit more about how someone gets into a support level. As you can see, there are 3 levels that are about general support need. Level 1 for individuals who have relatively low general support needs. Level 2 for individuals who have moderate support needs. And level 3 for individuals who have high general support needs. There are also 2 levels specific for individuals who have extraordinary needs. Level M for those who have extraordinary medical support needs, and level B for those who have extraordinary behavioral support needs. Each individual is only assigned to one support level. However, it's possible to meet the criteria for more than one level. For example, if Olivia had a score on the CIS-A sections 2A, 2B, and 2E of 32, then she would meet the criteria for level 3. However, if Livia also had extraordinary medical support needs that met the criteria for level M, she would also meet the criteria for level M. In that case, Livia would be assigned to level M because you are assigned to the level of your greatest amount of support need. It's also possible that someone could meet the criteria for both level M and level B. If that were to happen, then the participant would be assigned to the level of their greatest support need, either medical or behavioral. The verification review team, which we'll talk about more in a little bit, is who would decide which level between M and B someone should be assigned based on the information that they submit. I'm going to pause and see if any questions have come up about the assessments and about how we assign folks to levels 1, 2, and 3 before we continue on.
Alina, I'm not currently seeing any questions. I'm not seeing any hands raised.
Okay, very good. then let's talk about exactly how folks get into levels M and level B. So in order to get into level M or B, you can either be flagged or you can request assignment to level M or B. Once you have requested assignment to level M or B, you then will need to complete and send in something known as a verification questionnaire, as well as supporting documentation showing the type of extraordinary behavioral or medical support need you have. Once you've sent in that information, the verification review team will verify that your medical or behavioral support needs meet the requirement for level M or B. This process is intended to be very similar to the process that we currently use to assign folks to intents. The difference is that the verification process for levels M and B are available to everyone in the program, not just individuals who choose supported living. In order to be assigned to level M, someone must have an extraordinary need for medical support. That means that the person must have a chronic or acute medical condition or conditions that are so complex or unstable that one-to-one staffing is required to provide frequent intervention and frequent monitoring. In order to be assigned to level B, someone must have an extraordinary need for behavioral support. This means that the individual has a recent felony conviction or charges for offenses related to the serious injury or harm of another person, a history of predatory sexual offenses and is at high risk to reoffend, or has a documented, sustained history of serious aggressive behavior that shows a pattern of causing harm to themselves or others. In order to meet the criteria for level B, that person must require one-to-one staffing for at least 16 hours a day for support around those specific risks. Individuals will be flagged as someone who may meet the criteria for level M or B based on their responses to the CIS-A Section 1 and those supplemental questions. Even if someone is not flagged for levels M or B, they still can request level M or level B verification. During your assessment, the assessor will ask you or your respondents, if you were not present, if you want to go through verification. You can answer this question by saying, yes, I would like to go through verification. No, I wouldn't. Or, I only want to go through verification if I am flagged. If you do want to go through verification review, you're going to need to complete the verification questionnaire. This questionnaire is a new form that's being added alongside the new model. You'll be able to get this questionnaire via email on the department website, and Liberty will send you a copy in the mail if you requested verification during your assessment. If you don't request verification, you will be assigned to levels 1, 2, or 3 based on your answers to the CIS-A. One important thing to note about this new questionnaire is that you don't need to complete the whole questionnaire, only the section that is relevant to the type of need you are looking for support to address. So for example, if Livia is seeking verification for her extraordinary medical support needs, then she would only need to answer the section around extraordinary medical level of support. There are also sections about the different kinds of behavioral support that could warrant somebody getting assigned to level B, but she could leave those sections blank because she is looking for verification due to her medical risks. You would need to include the participant's name, the name of the person who's completing the form, when the form was being completed, and the phone number and email of the person completing the form. You would then answer the questions on the form and be sure to send in any other supporting documents that show the kind of support need that you've described on the form. The form provides a list of the kinds of documentation that we recommend you submit to help show that you meet the criteria for levels M or B. This slide provides some of the same examples that you'll see on the form about the kinds of documentation you may want to submit. If you're seeking level M, you might want to submit things like notes from your doctor, emergency room reports, detailed seizure logs, nursing plans, or hospital discharge summaries. If you're seeking level B, you may want to submit things like court orders or other legal documents, a sexual risk assessment that's been completed by a qualified professional, incident reports, behavior management plans, or police reports. The verification review team is the group who will be determining whether or not participants meet the requirements for levels M or level B. This team includes representatives from the Adult DD program, or the Bureau of Developmental Disability Services, the Crisis Prevention Team, and the Independent Assessment Contractor, or Liberty Healthcare. The verification team will then review the verification questionnaires, the documents you submit, as well as any records the department already has on file to see if you meet the requirements for levels M or B. Your notice, or eligibility and budget notice, will include the VRT team's decision, an explanation of why they made that decision, and exactly what documents they looked at to make their decision. You'll also have the right to appeal any decisions made by the verification review team if you don't agree with the outcome. I'm going to pause again and see if there are any questions about how the assessments are used or about how someone gets assigned to their support level.
I am still not seeing any questions, and I currently don't see any hands raised.
Okay. So the next thing we're going to talk about is how someone gets to their selected service mix. Your budget under the new model is based on two factors: your support level, so level 1, level 2, level 3, M or B, and your service mix. There are a total of 7 service mixes that participants can select from. 4 of those service mixes are for traditional service, or for folks on traditional, and 3 of those service mixes are folks who've selected self-direction. A service mix is just the term that we use to group participants based on the way that they choose to get their supports. So, do you choose to get traditional or do you choose to get self-direction? And the type of residential supports that they choose to receive. Participants are able to change their service mix at any time. This really is something that you are selecting. The only exception is that individuals who are assigned to the state plan HCBS only service mix can only change that service mix by receiving DD waiver eligibility. Because there is only one service mix for individuals who aren't eligible for the DD waiver, if you would like to switch that service mix, you would need to meet ICF ID level of care criteria or stop getting aged and disabled waiver services and elect to start getting DD waiver services instead if you wanted to change that service mix. This slide shows you the 4 traditional service mixes. The first is that state plan only. Again, those are only for people who only applied for or only qualified for state plan services. Sometimes these are also called 1915I services. Certified family home service mix for participants who choose to receive their residential habilitation from a certified family home provider. Community only supports for those participants who choose to not receive any supports in their homes, and the supported living service mix. This is for folks who choose to receive their residential habilitation from a supported living provider. The presentation today is focused on individuals who've made that selection. So in a little bit, we're going to walk through an example of how your support level and service mix get you to a budget using something known as a model mix, specifically for supported living. Each support level and service mix combination has its very own model mix. The model mix is just the way that the department figures out the budget that you'll be assigned. In addition to the budget that you are assigned, you also have other ways you can get additional dollars or additional services to meet your needs. These are all called budget modifications. There are 3 different kinds. The first is a health or safety service request. The second is a health or safety budget modification request. And the third is an employment-related service request. And we'll talk about all of those in a little more detail here in a minute. To understand how we get to the budget, it's important that we talk about a number of different steps. The first, we'll need to describe the 3 different parts of the traditional budget. Second, we'll need to explain which services fit into each part of that budget. Then we'll walk through how the model mixes work and show you the traditional model mix for supported living, since that is the service mix that applies for folks on the call today. Finally, we'll talk about all those other ways you can get services outside of your new budget. So the first step is to walk through the different budget components. As you can see on this slide, your support budget is made of 3 different parts. The first part is your residential supports, so those supports you get in your home. For folks on this call, this would be the support you get from your supported living provider. Discretionary supports are those supports that you get to do the things that you'd like to do in your community. There's a lot of different services that are included in this group, including all 3 of the new services. Planning supports are those supports that you get both to build your plan initially and to monitor or work with your plan over the course of your year. This is the portion of the budget where you will get the dollars to pay your service coordinator for their help and your plan developer for their help to help you write your plan. Remember that you're not limited to just the dollars that you get in these 3 areas, because you also can get additional dollars or additional services using budget modifications, either those for health and safety supports or those for employment supports. On this slide, we're going to show you exactly what services fit into the different components of the budget. As I mentioned, residential habilitation portion of the budget is specifically for those services that you get in your home. There are really 2 different kinds of traditional services that you can access, and for folks on this call who've selected supported living service mix, the service you would get is supported living services. Discretionary support choices include services like adult day health, developmental therapy, pre-vocational services, career planning, and community habilitation, which are all new services, non-medical transportation, as well as 2 services that are really specific to individuals who don't get any in-home habilitation. That's respite and chore services. One thing to note is that if you are somebody who uses supported living services, you also can use your discretionary dollars to get more supported living services. That's what will allow you to get all 24 hours of your support in a day from your supported living provider, if that's what you choose to do. Service coordination and planning includes, again, those services you get from your service coordinator and the service you get from a plan developer to build your plan. As I mentioned, there's a whole list of services that if you would like to receive that service, you just need to meet the criteria for that service, and then that will not come out of your budget. Those are things like skilled nursing, specialized medical equipment, environmental accessibility adaptations, behavior consultation, home delivered meals, personal emergency response systems, crisis intervention services, and transition services. The employment services that you can get that would not come out of your budget are supported employment and non-medical transportation specifically for supported employment. What that means is that if you need transportation support to get to or from your job in the community where you make at least minimum wage, you can get dollars added to your budget specifically for that purpose to make sure that you're able to get to and from your job successfully. Now that we've talked through the different components of the budget and exactly what services go into each component, let's talk about the model mix itself. In order to get to the model mixes, the department had to decide on the type and amount of service that they thought that most people would need based on their service mix and their support level. The department then figured out how much it would cost to offer that amount of service. They did that by taking each of the services they wanted to include, figuring out how much of that service someone would use over the course of a year, so the average annual units, and then the cost of that service or the rate that is paid to providers for that service. If you multiply together the number of units for the year and the cost of each unit, then you'll know how many dollars need to be added to the budget to offer that service. That same process is completed for every service in the mix, and then those amounts are added together to get to the total budget. Participants are not required to use the specific services that are included in the mix. That's simply the way the department got to the total budget. Another important thing to know about model mixes is that they can be changed as needed by the department. In fact, these model mixes have already been changed. The legislature recently approved increased rates for some of the services the program provides. As a result, the department went in and adjusted the model mixes to include the new rate or the new amount providers are paid. This increased the budget totals across all of the mixes, but also made sure that the amount of service that the department wanted to include could still be purchased with the total budget available once the new rates go into place. The model mixes, again, only explain how the department sets the budget based on someone's choice of residence and then their support needs. You do not have to use the services listed in the model mix. In fact, you can only use one or two of the services in the model mix if that's what you choose. Once we get to the budget, it's then yours to spend as makes sense to meet your needs. Again, you also can add those additional budget dollars for health, safety, or employment needs. So with that, we're now going to turn our attention to looking at the new model mixes. We're going to focus our attention on one of the model mixes, that for traditional supported living, because that is the group who this presentation is targeted for. However, a document with all of the model mixes is available on the My Choice Matters website. If you go into the Trainings and Information Sessions tab, you'll then be able to see an additional information, and I won't remember exactly the name of the next line, so maybe Olivia, if you could find that for me and make sure we put it in the chat. And that's where you can find the document with all of the different model mixes if you'd like to see others. Another thing to note is that because this is on a screen, it can be a little bit hard to read. So I'm going to take just a moment to walk you through the basics and show you how the model mix works. And then we'll focus in on one example so we can blow it up and make it a little bit easier to see. So this is the model mix for traditional supported living. The first thing to know is that across the top, you have all of the different support levels. Support level 1, 2, 3, M, and B. Down the side, you have the different components of the budget. The residential budget, the discretionary budget, the planning budget, and then the total budget at the bottom. In the next column, you have all of the services that are within that component. So if you've selected the supported living service mix, the only service in your residential portion is that supported living service. So that's what's included. There's a whole bunch of different services that are in the discretionary portion. And for all participants in all levels, there are two services in the planning section, that for plan development and that for service coordination. The next column shows you the rate or the amount the providers are paid to provide that service. It's given both at how much it costs to get an hour of the service and how much it costs to get 15 minutes of the service. For non-medical transportation, it shows you how much it costs per mile, since that is how non-medical transportation is paid. If you're looking at the top at the residential portion of your budget, you'll see these are costs per day. Those are also known as per diems. Now let's look at one example to look at it a little bit closer. So this is the discretionary budget for someone in level 1. You can see the different services down the line. It includes adult day health, developmental therapy, both center and community-based, the evaluation for developmental therapy, pre-vocational, both on the individual and on a group basis, career planning, community HAB, both individual and group, and that non-medical transportation. You then see the rate, and then how many hours per week were included in the model mix by the department. For discretionary services only, the model mix includes 50 weeks per year. We know that there are 52 weeks. However, these are the kinds of services that often take breaks for holidays or that someone wouldn't attend if they were ill. And so it's typical practice to go ahead and use a 50-week year when building the model. So if someone wanted 4 hours per week of adult day health, and there were 50 weeks in the year, then that would be 200 hours over the course of the year. At a cost of $11.16 per hour, the total amount that's added to the budget for that service is $2,232. This exact same process is followed for every service in the mix. How many hours per week? How many weeks per year? And then what is the cost per hour of that service? Then all of these amounts are added up to get to the subtotal. Now, for non-medical transportation, it is based on miles versus hours. So that's 56 cents per mile with 2,000 miles per year being added to the mix. And just because there are some services that aren't included in the mix, so for example, in level 1, there aren't any hours for pre-vocational, that doesn't mean that someone in level 1 supported living couldn't get that service. They absolutely could, because once they get their discretionary portion of their budget, they can use that portion of the budget to buy any of the services they see fit that are from the discretionary menu. Then we add together the different sections of the budget. So there's $27,000 for discretionary at level 1. Then there's the planning budget, which equals 12 hours per year for planning and 54 hours per year for service coordination. This amount is the same across all levels, across all traditional service mixes. And then there is the amount that's included from the residential budget. So while the budgets are made using a per diem, so a cost per day, individuals, participants are not required to purchase their services that way. So for example, somebody in level 1 supported living will get $83,750 approximately to buy their residential supports. They could choose to get 365 days of the level 1 per diem, which means 14 hours per day of group support, or they could use these dollars to build in the amount of residential supports that make sense for them. Maybe the person in this example lives alone and wants to get their supports on a one-to-one basis. They can do that using these dollars. Again, you aren't required to use the per diem just because that's what's included in the budget. The next slide just shows you the total of the residential, discretionary, and planning budget for each of the 5 levels for supported living. Again, the planning budget is the same across all levels. The residential budget goes up by level. The discretionary budget goes up for some levels, and is a little bit lower for level M or B. The reason for that is because individuals who are assigned to levels M or B get a residential budget that is enough to cover all 24 hours a day of their supports. I'm going to pause and ask for questions before we talk about budget modifications.
So we do have a couple questions. The first one I'm seeing is, when will the new rates begin? Did you want me to take a stab at that?
I was going to say, Danae, if you want to answer that, or perhaps Livia does.
So I can take a stab. So currently, the rates that we have approved for sure for July 1st are services that are offered from a developmental disability agency. So those services are developmental therapy and adult day health. So those rates take effect July 1st. The other services, such as supported living, pre-vocational, community rehabilitation, those services, we have not received CMS approval for those rates yet. So we anticipate July 1st, but that may or may not happen. So July 1st or upon approval by CMS, the Centers for Medicare and Medicaid Services, whichever of those dates is later.
Thank you, Janae.
Okay, and then the next question that we have is, do support levels have a number of hours the client is to be in supported living services to bill for the day?
Yes, they do. So the thing to know is that someone's support level, 1, 2, 3, M or B, does not match or does not mean that someone has to get that level of supported living, which can be a little bit confusing. But if you want to bill a certain supported living per diem, so if you want to get the level 2 supported living per diem, then what that requires is that an individual receives a certain number of hours of supported living supports in order to bill that. At level 1, the per diem includes 14 hours of group support. At level 2, the per diem includes 16 hours of group support. At level 3, the per diem includes, and correct me if I'm wrong here, Janae, because I'm doing it from memory, 12 hours of group support and 4 hours of individual support. And at levels M and B, the per diem includes 16 hours of individual support and 8 hours of group support. So that's how we get to the dollar figures you see for residential here. But just because that's the per diems that are included doesn't mean that that's the amount of support someone must get. Somebody who is assigned to level 3, for example, and who has enough dollars in their budget to get 12 hours a day of group support and 4 hours a day of individual support from their supported living provider can say, you know what, I don't want to get any individual support from my supported living provider. I'm okay getting all of that support in a group. So I'm going to use my dollars to buy level 2 supported living, even though I'm assigned to level 3. Again, anyone who would like to receive 24 hours of service from their supported living provider can do so, because you can use your discretionary budget to buy additional hours of supported living to work your way up to 24 hours in levels 2, 3, or M or B. The budget for level 1 is not sufficient to purchase 24 hours of supported living. And the reason for that is that individuals at level 1 are not assessed to have a level of need that would require that 24 hours of support.
All right, thank you. I am not seeing any more questions or any more hands raised.
Okay, let's move our attention to the next piece of the budget modifications. If someone's budget is not enough to meet their needs, or they have needs for things that aren't included in the budget, they can ask for additional dollars using a type of budget modification. This could be asking for a health or a safety service or an employment service, asking for more residential services for a health or safety reason, or asking for more discretionary services for a health or a safety reason. So as we already described, here is the list of services that are those health, safety, or employment services. Individuals can request these services on their plan by simply adding the service to their plan and then showing that they meet the criteria for that service. Included in all of the budget notices once we start the new budget model will be an attachment that provides a list of all of the health and safety and employment services and the exact criteria that is used to that it must be met to use that service. Everyone will get this document in their notices, and that way they'll know exactly what documentation you would need to submit to add a service to your plan. Individuals can also request a budget modification to either the residential portion of their budget or the discretionary portion of their budget if they need that for a health or a safety reason. The health risk form and the safety risk form have not changed from the old budget model. However, these forms will now be included in all budget notices, so you have them right there and available if you would like or need to request additional residential or discretionary support for a health or a safety reason. There's one additional piece that we want to talk about when it comes to the budgets, and that is the possible impact of the public health emergency and the American Rescue Plan on how we start implementing the new budget. Because of COVID-19, we are still in a federal public health emergency, and we do not yet know when that's going to end. Because of the public health emergency, the federal government provided states with extra money to provide supports and services. This was through something known as the American Rescue Plan. CMS, or the Centers for Medicare and Medicaid, put in place special rules because of the public health emergency. They also said that states can only keep the extra money they got from the American Rescue Plan if they do certain things. All of these rules are going to impact the way we start using the new budget model. The rules for the American Rescue Plan say essentially three things. The first is that a state cannot restrict eligibility for services from what it was on April 1st, 2021. The second is that people must be able to keep getting the same amount and type of service they were able to get on April 1st, 2021, and the provider rates can't go lower than they were on that same date. This is the piece that the department is still working with CMS to figure out about our new budget model, because we need to know exactly how the public health emergency and the American Rescue Plan will impact how we start using the new budget model. For now, we think it means at least these three things. First, that everyone who is found eligible for the DD program is going to stay eligible. What that means is that even if when you do your next Vineland 3, you don't meet eligibility requirements, you'll still be able to stay in the program as long as the ARP requirements are in place. The second is that any new applicant who are found ineligible using the Vineland 3 will have a chance to be assessed with the SIB-R. That's because the SIB-R was the tool that was used to determine eligibility on April 1st, 2021. Third, participants will still be able to access their current budget until all ARP requirements are met. The department believes that they will meet all of the ARP requirements in around March of 2024, but that date could possibly change. This means that the new annual budget notices, when we first start, are going to need to include both the budgets that were determined using the new model and the highest budget that you were assigned between April 1st, 2021 and the implementation day of the new budget model. For almost all participants, that dollar amount is just the same as your KW budget. However, you'll have access to that budget not because of the KW settlement agreement, but because of the American Rescue Plan requirements. So, moving forward, we're going to call that dollar amount your ARP budget. Your advisory budget is the budget that gets determined using the new model. A budget notice, when we move forward is going to look something like this. It's going to first tell you your advisory budget. So again, the budget determined using the new model, and it'll tell you the full amount. It'll also tell you that this budget is based on your assigned service mix and support level. It will then tell you the 3 different subcategory totals. So how much of that budget is for residential supports, how much is for discretionary supports, and how much is for planning supports. These 3 numbers added together will equal the number up here. The notice will then tell you your ARP budget. Again, this is the highest budget you were assigned between April 1st, 2021 and the date that we implement the new model, or probably what your KW budget is today. Then your assigned budget is just going to be the higher of those 2 amounts. So if your advisory budget is higher than your ARP budget, then that's the number that will be your assigned budget. And if your ARP budget is higher than your advisory budget, then that will be your assigned budget for the upcoming plan year. I'm going to pause for questions on that before we take a short break. And just a reminder, you are welcome to raise your hand and ask any questions you would like verbally as well. You are not required to type questions into the chat.
And I'm not seeing any at this time.
Okay. Then why don't we go ahead and take a short break before we come back and start talking about the next portion. So just as a reminder, so far we've talked about the new assessments, those that are used for eligibility and those that are used to assign your support level. We've also talked about the verification process and how that impacts how you get to your support level. We then explain how someone got to your service mix and how your service mix and your support level together are used to get you to a model mix, which builds the budget. We then went through all the ways you can get dollars beyond your budget using budget modifications and how the American Rescue Plan and the ongoing public health emergency are going to impact how we think we're going to start the implementation. When we return from break, we'll start talking a little bit more about how you actually develop your plan, some of the new services, and how you can make changes to your plan. Why don't we go ahead and plan to come back here at 15 past, so either 9:15 or 10:15, depending on your time zone. And then we will continue our presentation today. Thank you so much. All right, welcome back, everybody. Let's start talking about the next key step in receiving your services over the course of the year, developing that plan, and then getting the actual services. So the way that you develop your plans will be slightly different once we move into the new model, because we both need to make sure that it aligns with the new budget model and follows all of the home and community-based settings services rule. So, as we've already talked about, there are going to be more services for you to choose from. There's also going to be a reduction in the sublimits between services, and there's going to be some flexibility, particularly for folks who use supported living, to move between different parts of your budget. Plan developers are going to work with you to determine exactly what services you want to receive and how that might look different than what you receive today. Particularly for folks who are on supported living, you're going to have options around picking other kinds of services from the discretionary support section of your budget, figuring out how you would combine those services with supported living to make sure that you get all the supports that you need. Some folks may choose to keep getting all of their services from a supported living provider, and that's a-okay. But the entire plan development process will look a little bit different as a result. The department is going to offer a separate training on the new individual support plan form, as well as a different training on the support and spending plan for folks who use self-direction, coming up soon. We're not going to provide too much detail about that today, but just want to let you know that your actual plan forms and the planning process will be looking a little different as we move into the new model. And we will be sure that you get a chance to take a look at those new forms and learn more about that new process before you need to develop your next plan in the new budget model. The next thing we want to talk about is what's changing when someone needs to make changes during their plan year. Right now, when you need to make a change, so you need a different provider or you want to change your services, you would submit something with the help of your plan developer known as a plan addendum. This is a notification to the department and a request to change your service plan to adjust how things are going to work. Plan addendums are still going to exist as we move into the new system. However, plan addendums are going to be limited to changes in how you allocate the dollars in your plan when you are in the same level and same service mix. So, if you want to get a new provider, then that would be a plan addendum. If you want to stop getting community habilitation and instead start getting more supported living services, that would be a plan addendum. However, there's also going to be something new called a mid-year plan. Mid-year plans are going to be for those situations where someone has a change in either their service mix or their support level, and as a result, are going to get a whole new budget and need to develop a whole new plan to reflect that new level and service mix. There are 3 different reasons why somebody might need a mid-year plan. The first is because of a change in condition. If you submit a change in condition and as a result are assigned a new support level, then you will receive a new budget notice and will need to then develop a new prorated plan for the rest of the year. If in the middle of the year you want to change your service mix, you'll submit a service mix change request and will then receive a new budget notice that will be prorated so that you can develop a new plan for your new service mix. The third possibility is somebody who chose not to go through verification at the time of their assessment, but later requested verification during the plan year. If you got assigned a new level based on that verification, you too would get a new budget notice and would then need to develop a new plan with a prorated budget. We're going to talk about each of the different kinds of mid-year plans right now. So again, the first type of mid-year plan someone might need is because of a change in condition. You have the right to request a new assessment anytime there's been a major change in your support needs that make the current assessment no longer accurate. Your plan developer will complete the change in condition request form explaining what has changed. Liberty will then review that request and see if a new assessment is needed based on the changes that were described in the form and the supporting documentation. If they determine that a new assessment is needed, they will contact you to schedule that new assessment. Here is an excerpt of the change in condition form. Across the top, it'll have your contact information, as well as the contact information for your guardian if you have one. It will then ask you to describe the condition that has changed. On this slide, we provide an example. In this example, it explains that John experienced a series of seizures that required hospitalization. As a result of those seizures, John has less mobility and needs more assistance to prevent falls. He can no longer complete activities of daily living, skills, or talk as well as he used to. John struggles with communicating his needs more than he did in the past and needs more support as a result of the seizures that occurred. The form will also ask you to describe how the current assessment does not reflect the current status of the participant. In this example, they explain that the current assessment doesn't reflect John's current mobility or ability to complete his activities of daily living. It then asks you to list the documentation that was attached. In this example, they attached the hospital discharge paperwork, a physical therapy evaluation, a speech therapy evaluation, and a letter from his doctor. The participant and their guardian, if applicable, will sign the form, and then it can be submitted to the information coordinator at the department. After the new assessments are completed, Liberty will send you a budget notice. If, as a result of the new assessment, you have a new support level, then you will need a mid-year plan. Your plan developer will help you convene your person-centered planning team to develop a new plan that reflects your new support level and your new budget. That plan will be prorated, meaning it won't be for a full 12 months, but will just be for however much time is left in your current plan year. If, after the assessment, you're assigned to the same support level, you can keep your current plan and don't need to do anything else. If you have a change in condition before you are scheduled for your first Vitamin 3 or CISA, then you will be assessed using those tools so long as we have begun implementing the new budget model. So for example, if Danae normally gets her assessments in December, and in September, she has a major change in her needs, she can submit a change in condition request. And if that change in condition request is approved, then Liberty would come out and do her assessments in September versus waiting until December. In this circumstance, Danae would normally start getting the new assessments in December, but because of the change in condition request, she would get those assessments in September for this year. She could then build a new plan for the rest of her plan year based on the outcome of that assessment, and then would still go ahead and build her next plan based on her new support level when it came time to build her new plan for the following year. The next type of possible reason you could need a mid-year plan change is a service mix change. If you want to change how you get services, then what you will need to do is submit a service mix change request. This includes if you wanted to change between getting traditional or self-directed services, or if you wanted to change in the living situation. So if you currently get supported living services, but decide you'd like to start getting services from a CFH instead. If you've already done a CISA, then a service mix change can be done just by doing a file review. However, if you haven't had a CISA yet, you will need to be scheduled for a full assessment in order to do a service mix change once we begin implementation. Liberty will complete the assessment and send out a new budget notice. You will then work with your plan developer and your team to develop your new service plan to reflect your new living situation and your new service mix. The third type of mid-year plan is because of something known as an off-cycle verification. You are able to request verification at any time. However, we highly recommend that you go ahead and ask for verification at the time of your assessment if you believe you meet the criteria for level M or B. If you want to request a verification because your needs have changed, then what you would need to submit is a change in condition request. Anytime your needs change and you feel like that change is so significant that your current assessment no longer is accurate, the change in condition is the right request to submit. However, if you haven't had a change in your needs, but you simply realize in the middle of the year that you actually do think you need that level of support available at level M or B, when initially you thought maybe you didn't, you will need to send in a request to Liberty for a verification. Liberty will then send a notice asking you to provide supporting documentation and to complete the verification questionnaire. If the verification review team finds that you meet the criteria for level M or B, then you'll get a new notice and you can then prepare a new plan. If the verification review team finds that you don't meet the criteria for level M or B, then you will get a notice that gives you their decision and the reasons for their decision, but you can keep your current plan. I'm going to pause for questions. Oh, I think you're on mute, Danae.
Yeah, just talking on mute. We have one question. It is, if you have a mid-year plan change, will your yearly review date then be changed to when you had the new assessment done? For example, you had someone in September, their review would have normally been December. Will the review now be every September? And I can take a step this. No, so those mid-year plans will be prorated plans, so the end date will remain the same. So the read-at date and the date that Liberty typically does those assessments will remain the same, and that's why we kept those prorated, so we can stay on that schedule.
Yeah. The one thing we'll note is that if, in the example I gave, Danae got that CISA and Vineland 3 in September, she wouldn't have to get another one in that same year in December. It would just be done early. So, and then her next CISA and Vineland 3 would be on the regular schedule.
Okay, perfect. I'm not seeing any more questions or hand raised at this time.
Okay, so the rest of our presentation today is really focusing more on the service changes that are happening at the same time as the implementation of the new model. So to get us started, and as we've already kind of talked about, high and intense are going away. Instead, if you use supported living, and folks on the call today do, you can use both supported living and discretionary services to meet your needs. You do still have the ability to get 24 hours of supported living if that's what you would prefer. Another change is remember that those limitations on the number of hours per week, which was currently 30 hours, were removed. There are also new rates that are going into effect for supported living, adult day health, developmental therapy, and non-medical transportation. Non-medical transportation is now going to be a state plan service. Any unused service coordination units will be able to be rolled over and used in the remaining months of the plan, which means that if you don't need a lot of support from your service coordinator in 1 month, but then the next month you do need a little extra support, there will be extra hours available for you to get that support. Plan development has been increased to a max of 12 hours per plan, up from 6 hours per plan, to give your plan developer more time to work with you to build plans because of the added flexibility and new services that are available. And 3 new services have been added. Again, the 3 new services are community habilitation, pre-vocational services, and career planning. Community habilitation will be provided by residential habilitation or developmental disability agencies, and it is a service that can only be provided in the community. It's intended to promote skills and to help folks participate in community activities, social clubs, events, volunteering, or things that are of particular interest to them. This service can be offered on an individual or a group basis. However, if it's offered on a group basis, it should be for individuals who have the same interests or have the same or very similar goals. This is a service that really is focused and driven by the interests of the individual receiving that service. The intent of this service is to offer opportunity for someone to get support to do things in their communities at times when perhaps other services haven't typically been available. So if Danae loves fly fishing, that's a great interest of hers, and her local fly fishing club meets on Saturday mornings, that's not a time where she could normally get support from a DDA in order to get that service. She could, however, use the community habilitation service to get a provider to go with her to that fly fishing club and work on her skills in fly fishing and build community with other local fly fishermen in order to build her relationships in the community. Pre-vocational services and career planning services will be provided by supported employment agencies. Pre-vocational services are intended to teach general employment skills that can help someone get ready for paid employment in the future. This service is limited to 520 hours, and it can be accessed over 2 different plan years. The goal of pre-vocational services is to help someone build general skills around employment, not to learn how to do a very specific job. So if Livia needed to help learning how to communicate with her coworkers or how to talk with customers, that's something she could work on as a pre-vocational service if she wanted to work in an area that required those kinds of skills. This service can be provided on an individual or a group basis, and it really is intended to be time limited. The goal of pre-vocational services is to help someone build the skills they need to get ready for employment, not to stay in that service long term. Career planning is a service that's intended to help somebody identify their career objectives and build a plan to help them obtain or advance in competitive integrated employment. That means employment in the community where they make at least minimum wage. This service is great for people who aren't quite sure what sort of job they might like to have, or maybe who are already working but don't feel satisfied in their job and would like to change fields and do something that fits in more alignment with their skills and interests. This service can be used for only up to 4 hours per week, and it is offered only on an individual basis. Just as a reminder, you always have the right to appeal decisions from the department. Information about how you can appeal decisions to the department will be made available at a later training, and anytime the department makes a decision where you have the right to appeal, you will receive a notice that gives you that information and includes the form you can fill out to start the appeal process. This slide just provides contact information for all of the quality assurance specialists in your given region. That's who you can contact if you have questions about any of the materials that we've covered in this presentation or about other things related to the program. We also wanted to provide a list of different resources you can use to get more information. Again, that My Choice Matters website, Our Health and Welfare, which is a site run by the American Civil Liberties Union, and the website for the department. We also wanted to remind folks to please complete a short survey about this training following the training this morning. I will be putting this link into the chat in just a few moments. And to take a look at the My Choice Matters website for the other kinds of My Choice Matter discussion sessions that are going to be available in the coming weeks. We want to make sure that folks have an opportunity to get all of the information that they need about the new model. This afternoon, for example, there's going to be a training with even more detail about the new assessments than what was provided in this training. We're also going to have a session that talks in more detail about the new services, one that talks more about how to understand your budget notice, a session that just talks about the ways that you can get budget modifications or added things to your budget, and a session that talks more about the exact impact of the ARP budgets and how that's going to adjust the budget model implementation itself. With that, we have completed all of the content for today's training, so we can open it up to any remaining questions.
Okay, so I see a question here that says, what is the difference between supported living and certified family home? So I can take a stab at that, and then Alina, if you want to add more, feel free. So a certified family home is typically, so it's a family home where that family, they go and they go through the department, they get certified to provide support to a person who then would move into the residence. And they do some active treatment, basic supervision, you know, help them out. They're both, and then supported living is where somebody hires staff to come directly into their home and provide support in their home. So it's not a certified like house or anything. It's when you hire staff to come into your home to provide those supports versus moving into somebody else's home.
Yeah, I think that's really great, Danae. I think the thing to remember is that both of these services, supported living and certified family home, are both residential rehabilitation services. So the basic goal of the services are the same. The basic ideas around the kinds of supports that someone might receive in order to get the help they need in the home is pretty similar. The difference is really who's providing the support and who owns and controls the home in which those services are being provided.
Perfect. I'm just looking for hands right now. I'm not seeing any hands, and I'm not seeing any additional questions at this time.
All right, we'll wait just a couple more minutes in case somebody is typing a long one in there. We want to make sure everyone has a chance to get their questions answered. I did put in the chat the link to the survey on today's training. It's a very short survey, I think 2 questions, and offers an opportunity for you to give us any feedback about ways that we can improve this training or additional material that you would like more information on. We really want to make sure that the department has an opportunity to get you all the information you need before we move into the new model. So we really encourage you to do that survey if at all possible. I see one other question that came up, which is asking if CFH is available to minors. I know that this program only serves adults, so I can't speak to that with regard to any other sorts of services. I don't know, Livia or Danae, if you know the answer to that.
Yeah, certified family home is for adults only. It is not offered to minors.
Oh, and it looks like we have a hand raised. Could we unmute Gretchen?
Yes. Thank you. You can hear me?
Yep.
Okay, great. So just a really quick, a little tiny review. So I have two kids in supported living. One is more, so we can work and choose, like I can see one of them not not even wanting to do services outside supported living and one that does. So what you're saying is there's a lot of variety in choosing those for those individuals? Did that make sense?
Absolutely. Yes. So if one of your children says, you know what, I really like to only get my services from my supported living provider, then that is still a possibility, just like it is today on high and intense. That can be done in a couple of different ways, but one of the easiest ways is that they would simply select the per diem that they would like, so whatever level they're assigned to, and then they could use their discretionary dollars to add additional hours of supported living so that they would cover 24 hours of support from their supported living provider using those discretionary dollars. The new per diems don't cover 24 hours anymore for supported living to give people the flexibility to buy other supports, but they aren't required to do so.
Okay, yeah. That was a question I had. Okay, so they're not required to leave their supported, it's hard to know what words to say. They're not required to, like my one daughter, I don't really think she would need to go to like adult daycare, or I think she would prefer just to have a staff of the company she's with take her out. And so she's not going to be made to go to an outside program.
Nope. It's totally up to her and with support of her planning team to build the plan that's going to work best to meet her needs and
Okay.
her goals.
Okay, yeah. Okay, that totally makes sense. Yeah, thank you.
Of course. And I see another question that came in. Do the hourly supported living clients buy hours or do they fit into a support level? That's a great question. So folks who get hourly today will get assigned to a support level. And based on the support level they are assigned to, they will get a budget. Their residential portion of their budget, they can then use to buy supported living in the way that makes sense for them. So if today they use hourly supported living, they can use those dollars to buy hourly supported living or a per diem supported living, which are 15-minute units. Or if somebody who's currently getting hourly supported living wanted to buy, you know, a lot of supported living, for example, at level one per diem covers 14 hours a day of group supports. Somebody who gets hourly supported living today could use their budget to buy that. So then they would just get 14 hours a day of group supports, and that's how they could get it in the future. So everyone will get a support level, everyone who's a part of the program. It doesn't matter what living setting you're in, it doesn't matter whether you're a waiver participant or a state plan only participant, and the support level and your service mix together will help you get to your budget, and then you can choose how you want to use those dollars. Okay, not seeing any other questions. I think we can give you all 15 minutes back in your day. Thank you all for joining us today. Please do stay on the lookout for the My Choice Matters website. You'll get updates, including updates on the final implementation date will all be posted on the My Choice Matters website as soon as we have that information. So thank you all very much and have a wonderful afternoon and rest of your morning.